Today I'm going to talk about some muscles. They do like L-shaped hand. This is the L-shaped hand. So imagine that when you are holding the card in your hand, so playing the card, you'll have this L-shaped hand. So which muscles put your hand in this L-shaped position? So these muscles are known as the lumbricals. So lumbricals starts with L, so they can do L-shaped hand. I'll show you on my gloves these muscles. So first of all, I'm going to show you a tendon. We have a tendon which is coming from my forearm. So the tendon would be this. It is known as the flexor digitorum profundus tendon. So it is split into 4 tendons, each one for one of the fingers. So this is called the flexor digitorum profundus. So flexor digitorum profundus, as its name suggests, it goes down through the distal phalanx, and when it contracts, it can do flexion of the digit. But I'm going to talk about the lumbricals. Lumbricals are the worm-shaped muscles. So worm does not have any bone. So lumbrical, like a worm, it does not attach to the bone. Both origin and insertion attaching to the tendon and extensor expansion. So we have 4 lumbricals. They are coming from here. I'm going to start showing the lumbricals with the red marker. So imagine that this is my first lumbrical. So it's attaching to this flexor digitorum profundus like this. So this is lumbrical 1, 2, 3, 4. They are coming from the flexor digitorum profundus, but they attach to the extensor expansion. Where are the extensor expansion? How they get formed? So we have opposite to the flexor digitorum profundus, we have extensor digitorum. So it's coming from the dorsal compartment or posterior compartment of the forearm, and it splits into 4 digits. So it is known as the extensor digitorum. So extensor digitorum, as its name tells us, when it contracts, it can do extension. This is the flexion, this one would be extension. But the point is that the tendon of the extensor digitorum, it makes 2 wings and 1 central part. So the wings and central part come together before they attach to this distal phalanx. So they expand and covers these 2 joints. You know, we have 3 phalanx, proximal, middle, distal. Between 3 phalanx, we have interphalangeal joints, proximal, distal, interphalangeal joint, pip and dip, proximal, distal, interphalangeal joints. So I'm going to show you the extensor expansion for all digits. So what will happen for the insertion of the lumbrical? So as I mentioned earlier, the lumbrical muscles coming from the tendon of the flexor digitorum profundus, and then they cross this joint, this one, this is a metacarpophalangeal joint, and finally they attach to the extensor expansion like this, and the third one as well, and the 4th one attaches to the 4th extensor expansion. So this is the course of the lumbricals. So as you see here, lumbricals crossing the metacarpophalangeal joint. This is the metacarp, this is the first or proximal phalanx, so the joint is metacarpophalangeal here. So it crosses the metacarpophalangeal joint anteriorly. When it contracts, it can do flexion. It's bending the metacarpophalangeal. What else? It attaches here to the extensor expansion, which covers the pip and dip. So when it contracts, it can pull back the extensor expansion, which results in extension of these two fingers, these two pip and dip joints. So the result is that when the lumbricals contract, they do flexion of the MCP, metacarpophalangeal, but extension of the pip and dip, which makes this joint like L-shaped hand. Thank you.